Hello everyone, I welcome you back to the channel. Today we have with us a very special guest, and on request you guys have been asking me a lot about guide about USMLE and all their licensing exams. So today we have with us Dr Sahana Devakumar ma'am. She is from MBBS 2015 batch from JNMC Belgaum, and her USMLE Step 1 awesome score is 256, and she have been that person who have cleared it, and I think she is most suitable to guide you in the entire journey. And also you can connect with her on YouTube and Instagram at Dr. Deva, her page. So welcome, ma'am. We welcome you to this platform.
Hi, everyone. I'm so glad that he contacted me. I'm a big fan of his channel, and I would love to guide you all on any knowledge that you need about USMLE.
Thank you. Thank you so much, ma'am. So exactly like the audience watching it might be MBBS first year, second year. So I guess this is the right time for everyone, to know about this exam, because the more later you come to know about it, the more complex it gets, right? So we need to have a clear-cut idea that how you should approach it. So I'll request ma'am to start guiding the juniors. So for the beginners, please, you could explain what exactly is, USMLE.
Okay, so USMLE actually stands for United States Medical Licensing Exam. So if you want to pursue after MBBS, your PG in the US, you need something called ECFMG certification. Okay, that is their certification board, like how we have NMC and MCI before. We need to have something called ECFMG certification. Now, for ECFMG certification, currently, there are certain requirements that you have to fulfill, and there are many paths to take that. The most important requirement for it is your USMLE exam. Now, USMLE exam has 3 parts to it: Step 1, Step 2, and Step 3. Before, Step 2 had 2 parts, which is CK and CS, where CS was a practical exam and CK was a written exam. But since last year, USMLE has completely cancelled CS, and they said it will not be coming back either. So technically now we have 3 USMLE exams: Step 1, Step 2, and Step 3. Now, out of these, you only have to pass and get a good score on Step 1 and 2 for ECFMG certification. Step 3 can be given even after your residency or before your residency just starts, even after match. It's not a requirement. But my personal opinion is you have to give Step 3 because as of this year, Step 1 has become pass or fail, whereas before it was a numbered exam. So that is a basic summary of what USMLE is.
Right. So perfect. So I hope you guys have now clear idea of what are the basic steps, right? So now we shall, approach that. First of all, who all can give it? Like, is there any criteria to be eligible? Also, when should, an MBBS student give it? Also, the best attempt, like ma'am said, sometimes it's pass, sometimes it's fail, sometimes it depends on the number. So regarding that, please explain the eligibility criteria and when should one start, giving or preparing.
Okay, so eligibility criteria actually is a very important topic right now because the ECFMG has brought in some new rules for 2024. So after 2024, for you to be able to be eligible to give these exams, your medical college has to be recognized by a body called WFME. Currently, none of the Indian colleges are part of that.
Okay.
So if you're trying to get into this program, suppose you're in first year and you would probably be joining after 5.5 years, right? So things will change before that. Things are going to change now. But I'm telling you right now, if you're planning to give USMLE after 2024, you will have to have a medical degree from a WFME accredited university.
Okay.
So, but let's talk about now if you're trying to give it before that. Before that, when can you give Step 1? When can you give Step 2? So Step 1, you can ideally give it in 3rd year of your medical college. You would have to complete first year, second year, and you have to be in 3rd year at least. You can give it afterwards, but you have to be 3rd year at least. But since now Step 1 is pass-fail, my recommendation is you give it in 3rd year, where you can study a little bit along with your MBBS curriculum and get it done with. And it's only a pass-fail, so it doesn't matter what score you get. And Step 2 is ideally given in your internship.
Okay.
Now you can choose to give it earlier, but it's ideally given in your internship period.
Okay.
Now we currently don't know how it's going to change after 2024 because there's a lot of things which are confused right now. Everybody is trying to email ECFMG. From what I know is I've emailed them personally and they have said, if you apply for the exams and if you're ECFMG enrolled before 2024, you can get the certification done. But if you're joining MBBS and if you're in third year, only after 2024, then they themselves don't know what is going to be happening because India has a lot of international students and they'll be losing out on their major bulk of IMGs if they stop Indian students to come to the US. So there are a lot of things which are uncertain, but before 2024, step 1 in third year and step 2 in internship.
Okay, right. So it is very important, right from the exam point of view, that you always need to be updated. You should always have a sort of mentor or someone you can, connect with, and also have an idea that what are the current updates going on. So it would be really reasonable for you all to also connect with ma'am whenever you get any difficulties in future. Right. So regarding this, as you said that, okay, one should give ideally step 1 at that time. So what are the, difference in the approach? Like for NEETPG, a student is preparing, but for USMLE, should he be more clinical? What are the, first of all, the approach? What should be the approach? And also if there are any special textbooks, coachings or materials to prepare for it, please name some.
Okay. So approach is different. Right now, even NEETPG is becoming more clinical, but it's not yet at the same exam pattern level of USMLE as of now. I wouldn't say one is harder than the other. They're both very different testing styles. Especially when I was in first year, we didn't have the new curriculum that you guys have, which is an integrated system of clinics and textbooks, which we didn't have. But even then, the way we teach medicine in India is a little bit more didactic, where you just learn information rather than apply the information. So I would suggest you start getting used to USMLE kind of materials earlier on in your MBBS career. It'll help you for your normal exams also, because I use a lot of USMLE material for my second year for patho, for pharmac, for micro, because those materials are a lot more easy and simplified to understand than I found than all the most very heavy Indian textbooks were. Some of the best materials I have found for step 1 for my personal use, let's just start subject-wise so I can break it down for you, which is easier for someone who's studying in first year, second year. So anatomy is not very important. You can do your normal anatomy textbooks, whichever you're doing for MBBS. Physiology, there is something, Boards and Beyond is the gold standard video series I would recommend because it's time efficient and it's not that expensive. But if you are someone who needs to be taught very, very in detail and in a slower manner, there are other options like Kaplan available, or even Unacademy. And there's certain things that are coming up right now where you can learn in a slower manner, but I would recommend Boards and Beyond as first. So, and then there is something called Sketchy for microbiology and Pathoma for pathology. And there is Physio, PHYSEO for physiology. Now, you don't need all of these resources. There is a very, you should assess your own strengths and weaknesses and only use the resources you need. I have a very detailed step 1 prep video on my channel. So if you are really, really looking to prepare for step 1, please go watch that. I've detailed in timeline wise when you should start and what resources to be used, because that itself is like a 20-minute discussion on how to study for step 1. And these are some of the good resources you can integrate with MBBS studying. It doesn't have to be separate that I'm studying for NEET, I'm studying for MBBS. The knowledge that we're learning is all the same. So the best you can do in your MBBS is try to watch these videos earlier on. So when you're really preparing for your step 1, you're familiar with them. You don't have to look at these resources for the first time when you're starting to prepare.
Right. Okay, sure, ma'am. So as mentioned, you can check out the materials as per your, convenience and what you think is your weak subjects, or whatever way you feel comfortable. It's all up to you. And also you can check out our channel. So now, like wise, you said that, once you start preparing for USMLE, it's a long timeline. You need to be persistent. So what do you feel the pathway after clearing USMLE? Because always, destination is what everyone wants. So the students would like to know, like, after USMLE, how life would be different from, practicing in Indian scenario versus US scenario. Any highlights?
Very true. And I think the end goal is something you need to really think about before you get into this, because a lot of your friends will get NEET seat, they will get PG, they will move ahead in their life than you will. But if you know exactly why you're doing what you're doing, then it'll keep you motivated towards it. Yeah. I guess everybody's reason is very personal to do USMLE, but some of the gross differences I can reiterate for you. First of all, the working atmosphere is a lot more friendly, and I guess it's more interactive. There is less a hierarchy, a strict hierarchy where you're not allowed to say something, or there's a very strict reverence where if suddenly a senior professor comes, everybody has to keep quiet. Right. And personally, from working in a couple of hospitals and studying in college, I've realized that kind of atmosphere, which is a little bit based on fear and just reverence, doesn't work for me. I like to be very friendly with my professors, be able to learn with them freely, ask them questions, and ask them to be more involved in my learning also. That's what works for me. And that's why I wanted to go to the US to pursue my residency. You can also ask, why not other countries? There are so many other countries which are actually a lot easier to get into. One of the main problems for me was language. So there are countries like Germany which offer you a completely free education. You don't have to even pay for anything, and it's a lot easier to get into. It's not that competitive, but the problem is language. So there are only a few countries where English is the first spoken language. So you won't have a language barrier there. Right. Then coming to work hours, they do work you a lot in residency there, but they are capped. So they do have an 80-hour work week cap, which most of the time people all over the country abide by. Whereas here, I guess PGs, especially first year, second years, are overworked like crazy with no one to even keep a track of any of that. Then another point is medical research is very, very important part of your curriculum there. It's not something you do as this is a nice bonus. No, you have to do that for you to excel even in your career, which is something I'm very interested in. And I want to pursue that in my future also. So that was a decision I made. Then let me think of some of the differences. Lastly, let's not forget pay. So the pay scale there is a lot more different than the pay scale in India. Whereas the average salary for a PG here would be, let's say, 40,000, 50,000 rupees average over the 3 years. There you will probably get $3,000 to $4,000 per month. So how much you're saving would be, I'm talking about maybe if you save, let's say, $500 to $1,000 a month, you will be saving almost $70,000 a month. Right. So if earning more is an important thing for you in your residency, that is a definitely better option. And even your fees to go there, unless you study in a government college in India, the fees overall for your entire USMLE journey would probably cost between 20 to 25 lakhs. But if you study in a private college in India or a deemed university, you will be paying 3 times that amount only as tuition fees. Right. So you take all of those in considerations, you weigh out your personal reasons. There's so many other things to be taken into consideration, like your visa status, family there, how you are willing to work and study and stay on your own. There's so many things you have to take into consideration about your own personality and then make this choice.
Right. So on the similar note, ma'am, one question that I would like to ask at this point, like you said, you have to take care of all the visas and whatever stay you are having there. So on the similar note, students would like to know, like, what could be the, some budget or what are the roughly expenses before getting that particular residency, because it's very important for everyone to take care of that as well. And just, not start preparing, but first you should also be financially sound according to the requirement. So a rough budget you can tell about, like, how much students should have that in mind, that it's not they have to spend.
Okay, so let's divide that into 2 things. Let's divide it into exams and let's divide that into American clinical experience, which also you need as a part of your CV. It's not a necessity, but it's such a big boost to your CV if you have it. So firstly, exam fees, the USMLE exams are expensive. They average around $1,000 per exam. So USMLE Step 1, Step 2, and Step 3, if you're choosing not to give, plus minus, depends on you, so which each will cost around $1,000. Then you will have a lot of practice tests, materials, UWorld. According to your convenience and your budget, you can choose how many you want to do, how many you can't do, and maybe you can share with the person, you can form a group and split it. There's so many things you can do, but I'm going to just tell you the average cost of all of those will also come up to $2,000 for Step 1, Step 2 together.
Right.
Now that you're already up, let's say $7,000, you're already down, right? And then you have travel, which will cost you another, let's say $1,500, $2,000, just flight tickets alone. And depending upon where you're doing a rotation, suppose you're doing an elective and not an observership, electives at universities cost a lot. They average around $3,000 to $4,000 per month. This is excluding your stay and your food and travel. So this is just your elective fees alone. But you can cut costs on that by doing maybe going through some known contacts or rotating at clinics and going through some agencies which probably charge you a lot lesser than electives. But if you're getting electives, I'd say do them if you're financially capable of handling the burden. But those are some of the expenses that will come up. Then apart from that, your stay and food there, if you don't have any family you're staying with, will be another like $3,000 at least for 3 months. And 3 months is a minimum.
Right.
So the basic cost will come up to 20 lakhs.
Right.
And if you can obviously reduce that, and it can go way over that also, but this is the average amount it comes up to mostly.
Right. So as you guys now know that there should be a basic financial sounding that you need, and you should be aware of that and also plan it well accordingly, right? And having contacts as well as relatives is always, something very helpful if you are preparing for USMLE,
Yes.
as ma'am told, right? So now also, do we need to give any other language exams in regards to USMLE prep?
Yes, so you do have to give a language exam. So I told you, right, ECFMG certification, there are many things you need to get certified, out of which one thing is your exam. The other thing you need is a pathway verification. So because of no CS, there are different pathways you can get to verification of your ECFMG certification. So the most common pathway is pathway 1, where you're already a medical practitioner in India and you have a license. So your licensing board needs to send an email to ECFMG verifying your license. So that is the second thing you need for verification, for certification. The third thing you need for certification is an OET, OET exam is an English proficiency exam, which is particularly for medical doctors, which you have to give before you go for your USMLE certification. But you don't have to give it before your step. You can give it before you're planning to apply for match.
Okay, sure. So this is all you need to know regarding that as well. So now at the end, one might think that, okay, how many attempts can somebody give? Like some people, say that it sounds like the CA system, like chartered accountant bante, so there are many steps, right? So common question is that, how many attempts can somebody give? And also if somebody gets stuck in a particular attempt or, could not perform that well in the upcoming steps. So what should be the, go through for that?
Okay, so forgive me if I'm wrong, but as far as I know, until recently it was 7 attempts. Okay. You can give 7 attempts max, but I think they reduced it to 5. Like the newest guidelines say 5. But the main thing you have to remember is if you do have a failed attempt, it does have a big effect on your CV. So you'll have to make up for it with maybe good scores in your second exam, or really good research, or really good letters of recommendation from doctors who are the best in their field to make up for that. It's not something they overlook. It's not like NEET where you can give how many ever attempts and the score at the end is what matters. No, how you get there also matters very much for this process. I wouldn't say be disheartened. If you didn't do well, the only thing that is in your control is to do well the next time. And that's one good thing about this process is that you have so many areas to excel.
Right.
If your scores aren't that good, you can make your research really good. If your research isn't that great, you can network and get a lot of good letters of recommendation from good professors. Even your other skills, like if you have a really successful YouTube channel, if you're an entrepreneur, if you're a writer, if you're a dancer, all these things add to your personality, which they take into account. So you don't have to be disheartened only about your scores, but they are the most important things for international students.
Right. Okay. So I think this is the perfect, as well as balanced, informative, as well as motivational boost that you all must be looking for. So now we will come towards the conclusion of this video, and I would request ma'am to, give some crucial tips on how to crack it, some golden points that she herself feel that I wish I could know this before I was starting my preparation, and also some areas of how, one should build their CV right from first year, what activities one should do in medical colleges so that it can help them in long run.
Acha. So I like the way, I know there's some things I wish I knew earlier on, so it could have helped me a little bit. So let's start with certain things you can do in MBBS to better your chances of cracking USMLE. So number one thing is being a participant in a lot of research projects. If you can get published, if you're a part of good PubMed index publications, they obviously help you in the long run. It doesn't mean you should go and do something which you're completely not interested in. Always find an area of interest so you don't have to fake it. It'll be such a pain for you to fake interest in something. So you find an interest in something and you try to pursue it seriously. You don't have to let this take away from your MBBS studies, because studying MBBS well is one of the main big boosts for me for doing USMLE. I think because I studied really well in MBBS, it helped me. It was such a big jump start for me when I started my USMLE prep. Usually people used to take 8 months, 9 months of step one. I could finish it in 5 months because I studied my basic sciences and my final year exam portions really well, which I didn't have to start from scratch again. So do not ignore that part of your education. Then there are a lot of things personally, which I did was I attended a lot of quizzes. I like quizzing as a person in general. It's just something I like to do for fun, but they do add some sort of maybe diversity to your profile. Then there are a lot of camps and health camps that you can organize or be a part of, which show that you're interested in benefiting human needs and helping people, and you're a humanitarian in general. Then there's some organizations called IFMSA, which organize student exchange programs between different countries. And if they see that you have had diverse experiences, that would definitely benefit in your CV also. Now coming to the exams, the most, I don't know if there's any golden rule to cracking these exams, but I think the most important one I have found is self-belief, because so many people get so scared looking at the length of the journey that if you just break it down into smaller steps, it gets a lot more palatable. There are 100 things you have to do, but just break it down to, okay, this month, what do I have to do? Next month, then step one, then a few months later, because if you think about it at a whole, it gets overwhelming. So you need to have that belief that so many people before you have done it, and so many people after you are going to do it. So you are no different than anybody who can do it. So it's just that mental block even I had earlier on. So I was so scared of attempting it. But I think once I gave my step one, I realized this is just an exam. So I think everybody, if they put their mind to it, can definitely do it.
Right, definitely. So at the end, whatever you are preparing for, be it USMLE, be it PLAB, be it NEETPG as well, you need to break it in small steps. You need to work in small steps each and every day, each and every month. Have a clear vision, and most importantly, have a mentor, right? So you always need to have some guidance. You always need to know about the updates. So I guess today we did justice to your time, and we served you with guidance and all the required information regarding USMLE. We will also continue the series maybe further, and as and when ma'am will keep guiding us in our entire journey. And also, if you have any questions, you can comment below, or also you can ask to ma'am on her personal Instagram handle. So I'll mention all the links below. You can surely check that out. And I hope today's video was a boon for you. Thank you so much, ma'am. Thank you for your time.
Thank you so much. It was really nice talking to you.
Yeah, sure, ma'am. Okay, guys. Thank you. Stay safe, stay healthy.